This three-step theory is applicable to many different therapeutic areas. We have designed study protocols for joint health, for immune health, for cardiovascular health, for brain health, for eye health. It goes on and on. Really, the key is to understand the underlying physiology, understand the population who it's appropriate to test in, and then come up with creative but scientifically valid ways of running this process. For one example, we can talk about knee joint health. So when you're talking about joint health, we're not talking about osteoarthritis. Osteoarthritis is a disease. A dietary supplement that would try to make a claim of joint health needs to be tested in a population of people who are at risk. What does at risk mean? It means that they're not with osteoarthritis yet, but probably in 5 or 10 years, if the things continue the way they are, they will be diagnosed with osteoarthritis. So in the case of joint health, we look at people who have joint pain when they exercise. They've had some sort of injury in the past, maybe some low level of inflammation, maybe some changes in the cartilage, and they're at risk for becoming osteoarthritic. The second thing we do is we apply a standardized stressor. So again, with the joint health, if I tell somebody who does not have knee pain at rest, so they're not arthritic, but they only have knee pain when they exercise, then I have to have them exercise. There are tests that we're familiar with, the 6-minute time walk, even the stair climb, but you can't standardize the amount of effort that the patient is giving. So we created a standardized step mill protocol, where the step mill, like an escalator, comes down, and patients are put on there for timed amounts at each level until they reach a certain level of pain. They have to have a certain level of pain within 10 minutes in order to qualify, and then we look at what is the time to onset of pain and what's the time to offset of pain and discomfort. Then finally, in terms of selecting clinically relevant endpoints, again, to stay with the knee joint health scenario, instead of looking at inflammatory markers, which may reflect inflammation inside the knee, but will a consumer really understand what an IL-2 is, an interleukin-2? Probably not. But a consumer will understand, oh, if I take this product, I may be able to exercise longer before I feel discomfort in my knee. And once I start feeling discomfort, if I stop, the pain will go away sooner. Those are messages that are scientifically valid, perfect for the regulatory environment under DSHEA, and a message that the consumer can understand.